The most common disease of horses is dental disease. It's not ulcers. It's not skin problems. It's not eye problems. It is dental disease. Over 50% of horses aged over, sorry, 60% of horses aged over 15 years are going to have some sort of dental disease. It is a really common thing. And this is why it's important that when your horse gets its dental done, it gets a complete full oral exam looking at all surfaces of the tooth, as well as floating those sharp enamel points and malocclusions. So floating the teeth is just a small portion of this, of doing dentistry in horses. The majority of it is identifying the pathology and treating the pathology. I always feel really bad for horses that don't get that complete oral exam, because owners think in their mind that they've been a good horse owners and they can tick the box, yep, my horse has had a dental and is good for another year now. But if that pathology is not identified, then that horse misses out on the opportunity to be treated. And knowing that dental disease is often a painful process, it breaks my heart when those horses, when we see them, have been in pain for a really long time. You can get things like slant mouth. So this horse had a problem with its TMJ joint up on one side, which meant it couldn't move its jaw properly to one side, and this is what develops. And then you've just got weird cases that you'll see. This is another Tasmanian case here where we've got those teeth going sideways and we're missing most of these teeth. Again, another missing tooth here. And then we've got another type of disease that we'll talk about it in a little bit, but you can see how enlarged the area underneath the gums are, and we've got a fair bit of gum regression on there as well. So the next thing that you'll be able to see as a horse owner is a malocclusion type 2, which is often called a parrot mouth. So this is a problem where the top jaw is longer than the bottom jaw, and these top teeth will actually sink down and over the top of the bottom jaw, and this can cause really big problems if it's severe, such as here you can see this x-ray here is actually of this horse here. It was only a couple of years old, this poor little guy, but had a really severe bite and some overjet in there as well, and could not move his jaw properly at all. So we actually ended up doing surgery on this guy, and he did pretty well. So parrot mouth in horses is pretty common. Sometimes you'll only see it like quite mildly like this. Other times it'll be a little bit larger like this, and you'll start to see some wounds behind those front teeth, or you can get it when it's really bad, such in this case where the top teeth are quite away in front of the bottom teeth, and they're the ones that we really need to treat because they can be very severe. We then have a malocclusion type 3, which is an underjet, and that's called a monkey mouth. So this is much more common in miniature breeds, so both miniature donkeys and miniature horses. And this little guy here was not even a day old when the owner called us out to say, please can you come and have a look at our foal because there's a problem with its mouth. And yes, it definitely was, but nothing that actually needed treating at the time. An interesting point to make about looking at the occlusion of the horse's incisors is that the horse's head needs to be in a relatively neutral position. So a lot of people will want to raise their horse's head up really high like this to get a look at the teeth. That's not a natural carriage of the horse. So make sure that your horse's head is in a natural position of carriage when you're looking at the occlusion of the incisors. And then I feel like I've said the word funky quite a lot here. But again, there's all types of funky malocclusions you can get. And this is a malocclusion type 4, which is rhinos, which has a very long, fancy Latin name. And in cases that are severe as this is generally not compatible with life. And it's not because of the occlusion of the teeth. It's because their nasal passages, where they can breathe air in, is often compromised. So these horses struggle to be able to breathe normally, and often unfortunately, they are euthanized on welfare grounds.